Hello, good evening, everyone, and welcome back to my mental health and crime channel. My name is Huda London. Please like, share, and subscribe if you enjoy the contents in this channel. The reason that I started this channel was to spread awareness for missing victims, for people who do not have a voice of their own, for vulnerable people, for mental health illness victims, domestic violence awareness, and positive awareness so that we can try and help people who need guidance, etc. Please like, share, and subscribe. Today I'd like to talk to you all a bit about my line of working, that is cognitive behavior therapy. I'm a licensed cognitive behavior therapist. Cognitive behavior therapy is a science-based uh, science-based studies that it is proven to be very effective for many things. Example, anxiety, depression, PTSD, other mental illness like bipolar, schizophrenia, multi-personality disorder, SOO, offenders, antisocial personality disorder, and many other people who suffer with different mental illness. Depression and anxiety is one that almost every human being suffers through a couple of times in their life. If not, I saw this recent study that said at least once a year. Looking at society these days and the stress and then the space of the stress that we live by, and with all this financial burdens and with the COVID epidemic that hit us 2 years ago, I personally believe that I'm sure there are many more people, thousands and thousands of people who are suffering of anxiety and depression without even knowing that they are suffering of it. Symptoms of anxiety and depression are usually, like, this is basically, I will explain it in my terms. This is entertainment purpose only. I would say that, like, if you do things regularly, like, besides your daily things, but just say you come to a stage where you're having a hard time meeting your daily basis things that you usually do. Just say, like, when we usually wake up, we tidy our bed, brush our teeth, have breakfast, have a bath, the usual. But then when people suffer of depression, example, they could just get up one day and decide, no, I don't feel like getting up and doing the daily things. And then it could lead on to maybe the second day, the same thing, the person doesn't feel like getting out of their bed. And it's not that they don't want to get out of the bed because they're lazy or because their body's in ache. It's just that they could be suffering from a mental illness like depression without even realizing it. Then they could come to a stage where their parents, just say like the parents or their friends, notice that they do not want to meet them much anymore. They don't answer the phone calls. They don't do much. Things have changed for them in general. Maybe they notice they're more irritable. They're more edgy. They get quickly upset for no reason. Maybe they don't want to socialize anymore or have a social life, and that can draw them to have social anxiety, basically. The thing with depression is that if somebody does not get help in the long run, in a term, it can lead into other mental illness. That's what most people are not aware about, or that's what most people do not focus much on. I believe personally, and in mental health too, we believe that it is important to do proper self-care. Self-care means like take time for yourself. Whether you take a run or jog or meditate, or maybe just say that a good example is you're on social media maybe 10 hours a day on YouTube and Instagram and all those other social media. And that may just make you more anxieties, stress, and then maybe you get some comments, rude comments, or you may assume that somebody meant something bad and that would ruin your whole day, and that could make you even believe that you are the cause of the problem, that nobody likes you, that you're better off gone. And then you start having negative thoughts. And that is the problem. When negative thoughts come in, it's important to have a good self-talk with yourself, kind of. I don't mean like a crazy person talk to yourself, but I mean like tell yourself that, ask yourself, where's all these negative thoughts coming from? Challenge yourself. That's what in cognitive behavior therapy we try to do. We challenge the negative thoughts with positive thoughts. Like ask the client, just say example, if the client says, oh, these days I don't feel like going to university and all, because I believe that most of my university friends don't like me and they look at me in a wrong way. I believe they're judging me. Or then you just ask them, like, what would make yourself believe that way? And they would be like, oh, they did not say hi to me the last time I saw them, and they usually do that. Then I would have asked them, what makes you so sure that the person actually saw you? And then they may even sit and think to themselves, oh yeah, actually, I noticed the person was looking at me, but her eyes were quite distant. She was thinking about something else. And then maybe next day you see the same person and you challenge yourself to go and say hello to the person, and the person will be completely fine and normal with you. And you'll be like, why didn't you say hi to me last time? Why didn't you say hello when I said hello? And then the person may turn around and say, did you actually see me? I didn't see you. I'm sorry. I was far away, and like my mind was far away. I was trying to get my grades to be changed, or I was talking to the teachers or something like that. So what I mean by that is, like, we can assume, it's very often we are, we create our own negative thoughts. And when we create that, if we don't challenge our negative thoughts with positive thoughts, then we do have a problem. We do not have a problem. It will lead you, your negative thoughts, the cognitive will lead you into getting negative behavior and that will lead to negative feelings. And then it's a circuit that will keep on going on and on, will get a person isolated or depressed. And then that depression can go on for a long time. So it's important to identify a problem, and once you realize you have a problem, seek to talk to your counselor, your professional mental health therapist, or maybe, I believe at the start you have to go to your doctor, and then your doctor will hear your symptoms and he may recommend counseling for you, or he may recommend a psychiatrist evaluation if it's more serious other form of mental illness. And once the psychiatrist diagnoses the problem, He may put the person on medication and may recommend them to go to counseling. And cognitive behavior therapy is science-based, is very science-based, what's it called, confirmed that it is a very positive therapy that works for most of the patients. I would advise everyone who's suffering of anxiety, stress, phobia, and such things to maybe make yourself a learning journal. It does help. A learning thought journal, so that you can write your daily moods, how you feel. And then when you keep on writing it for, just say, for a couple of days, the next time, that's what we usually do. We give our clients kind of homework, like kind of some CBT techniques to do at home. Just say if they're suffering of anxiety, then like we give them some skills so that they can use when they're panicking or when they're suffering of anxiety. Basically, counseling, many people misunderstand and think that counselors and psychologists and psychiatrists heal people. We do not. Therapy doesn't heal, but therapy helps the person to change their negative thoughts into more positive thoughts. So I personally say always, it's a client that is doing the job. So it's like we as counselors and therapists and professional practitioners, it's our job to help our client by, number one, I personally believe active listening, so that you can identify where the problem is coming from. Then we try to challenge them with their negative thoughts so that they can work on it to make it more into positive thoughts. Because once you have positive thoughts, or once you stop, I'll be honest, putting so many negative thoughts in your head, then you can see the problem clearer, and you kind of, to put it this way, I believe sometimes that we could be struggling with a small problem, but then it depends how we handle the problem. We can decide to put in more stress to the problem, like add more kerosene on the fire, or we can decide to calm it down a bit. That's how stress and anxiety works. If you feed your brain with positive thoughts, positive answers will come back. And you will see a positive change in your behavior, in your thoughts, and in your emotions. Whoever's suffering, example, of social anxiety and doesn't want to go out and who's been suffering of that, I would advise you to take a step by step. You don't have to do everything at one time. Just say if you're having problems like with, even you don't want to draw your curtains and get light outside and all, I would have advised you, like, start with maybe draw one curtain of one room and then see how you feel. If it doesn't work in a couple of hours, put it down. Then next day, if you believe it went well with opening one curtain in one room, the next day challenge yourself to open another curtain. And the day after, challenge yourself to open half of the curtains in the living room, and then so on and so forth. You'll be surprised how much we can do as human beings with our brains. It's just of us telling ourselves the truth that we are capable of doing more than we think we are. So change everything with positive thoughts. I personally believe, like I always tell my teenager boys, what is the point of stressing? Because it's like he would want to go and buy a tracksuit or something, and then it's like he'll make a big fuss out of it, like, I need it now, and if I don't get, I ask him always, you have the money, nobody's refused you the money, you deserve it, you're going to get it. But there's no stress. You don't have to get it this minute. Go get it tomorrow. And he'd be like, no, you don't understand. If I don't get it now, this and this, and then I'm not interested. I don't want it and all. And he hates the word when I keep on saying, think positive. But then what doesn't understand is it is important, because if you think negative your whole, not only your whole day, but it can lead into serious mental illness if you don't deal with depression or anxiety. There was another topic in mental health that I really wanted to talk about, because it seems to be happening very often in real life. And like I said, with all the anxiety and everything that's taking place in the world, with COVID, with the war that is happening in Ukraine, peace be upon Ukraine. To put it this way, with all the stress and everything that's happening in the world,